Today at the National Press Club, Dr Kay Patterson, the Age Discrimination Commissioner. She'll discuss what needs to be done by governments and communities as Australia's population grows older, with a quarter of the population to be over 65 by 2050. Dr Kay Patterson with today's National Press Club address.
Good afternoon and welcome to the National Press Club of Australia here in Canberra for today's Westpac address. My name is Andrew Tillett and I'm the Foreign Affairs and Defence Correspondent for the Australian Financial Review and also the club's Vice President. Our guest today is Kay Patterson, Australia's Age Discrimination Commissioner. Dr Patterson was appointed Commissioner in July 2016 and will soon finish her term, so this is a bit of a farewell address. She is no stranger, though, to Canberra's corridors of power. Dr Patterson was elected to the Senate in 1987 as a Liberal representative from Victoria and served on the front bench in John Howard's government and was appointed to Cabinet in 2001 when she became Health Minister and later Families Minister, giving her an insight into two of the Commonwealth's biggest spending portfolios. Successive governments have highlighted the demographic challenges that Australia will face from an ageing population, such as the impact on workforce participation and the spiralling budgetary costs of health and welfare spending. Just a couple of weeks ago, from this same podium, the current Aged Care Minister, Annika Wells, outlined the government's agenda for aged care reform. And our ageing population is also sparking debate about intergenerational wealth, superannuation concessions and home ownership. So Dr Patterson's speech today is on building the right culture to accommodate Australia's ageing population and is very timely. Just a quick note, for regular viewers, our background is slightly different today. This is in preparation for Sunday's welcome to Canberra appearance for the Insiders TV show on ABC, so please tune in for that. But anyway, for today, you can follow the conversation on Twitter at PressClubAust or hashtag NPC. Please everyone welcome Kay Patterson.
Well, thank you very much, Andrew. And I'm sometimes introduced incorrectly as the Ageing Discrimination Commissioner. That was a more accurate introduction, thank you. I want to acknowledge the Ngunnawal people, the Ngambri people, as the traditional custodians of the land on which we're meeting, and I pay my respects to their elders, past, present and emerging. I'd like to recognise in the audience, there are a lot of people, my godson, and lots of family and friends, but in particular I want to recognise the Honourable George Brandis, who actually appointed me to this position almost 7 years ago. Thank you, George. The Honourable Margaret Reid, thanks Margaret for being here and for all you've done, particularly for Canberra, but particularly in the Senate as the first President. Former Senator Sue Knowles, who used to sit behind me and hand me answers to questions could you come up here and pop up and help me answer the questions? Emeritus Professor Ros Croucher and Helen Watches from the President of the ACT Human Rights Commission, and Ros is the President of the Australian Human Rights Commission. I don't do this work alone, so I'd like to thank my fellow commissioners. Most of them have got very, very good excuses not to be here. They're in Melbourne or they're somewhere else, and I had a lot of messages this morning on my phone to say break a leg, so I thank them. And I also want to acknowledge my staff who are here, past and present. There are a number of wonderful past staff. In fact, Randall Markey and I have discovered we're living 125 metres apart, so I'm sure we'll reconnect again now. But I want to thank them for their support over the years. I'm pleased to see a few of the members of the press, and I don't think Laura's excuse is adequate. She's having a knee reconstruction today. She should have sent a question in. But I think I'll forgive her for not being here and wish her all the best. I've had a knee operation and it's not pleasant. When I came here last time, I did feel a little nervous. 20 years ago it was, almost to the month, and time has flown. But I feel a bit less like Daniela in the Lion's Den than I did on that occasion. I don't think the press is going to be quite so severe. Hopefully not, Andrew. As Australia's second Age Discrimination Commissioner, I just want to pay tribute first to my predecessor, the late Honourable Susan Ryan. Susan and I first met when we were senators in Old Parliament House. And on my appointment as a Cabinet Minister, she'd left Parliament, I received a very unusual letter, I thought, a wonderful letter. She wrote to me congratulating me on joining a small group of 8 Australian women. When I tell people in the Commission that I was the 8th Cabinet Minister, they hardly can believe it, how things have changed and how much more do they need to change. In her role, one of her major contributions was to highlight age discrimination in employment, and her report, Willing to Work, still has relevance 8 years on. She vigorously promoted the willingness of older Australians to work, and she supported me in my role, and we met usually about every 6 to 8 weeks, and her sudden death meant the loss of a great advocate for older Australians. The title of my speech today is Building a Better Cultural Inheritance for an Ageing Australia. As most people know, Australia's population is ageing. Many of us will live and work longer than our parents and grandparents, and indeed many of you will live into your 90s and some to over 100. This is where the most striking illustration of ageing is evident. In 1975, and some of you here will remember 1975, we had 120 centenarians in the whole of Australia. By 2021, this had increased to about 5,300, and by 2041, just 18 years away, it's projected this will triple to 16,000 and 40,000 in 40 years from now. Some of you will be here 40 years from now, and there'll be a huge number of centenarians. Some of them may be you. In the next 20 to 30 years, the statistics indicate Australia is likely to experience significant demographic change. Our population will become the oldest it's ever been. The number of people aged 65 and over will double to 8.9 million. And people aged 85 and older will triple to 1.9 million. But the number of working age people is projected to fall. There will be the biggest transfer of intergenerational wealth in history. It's set to happen at the same time, with $3.5 trillion of assets likely to change hands in Australia alone, as the assets of the war baby, otherwise known as the silent generation, a misnomer, I believe, and baby boomers are passed on to younger generations. Their assets are passed on. Together, these events will have massive consequences. Possible imbalances in workforce and employment opportunities, pressure on particular sectors, including the provision of aged care, and an increased risk of elder abuse. This could be seen as a calamity or a perfect storm, or the opportunity for our country to lead the way in creating inclusive communities which celebrate diversity, including people of all ages. Very rarely do we hear in discussions of diversity about age diversity, age being included. Perhaps the circumstances will be all of the above, but irrespective, we must plan and invest in the outcomes we seek as a nation. In my experience, the greatest obstacle to capitalising on these opportunities is the insidious nature of ageism. Ageism underpins much of the age discrimination work we do at the Commission, so we are well placed in this human rights battle. In 2021, the World Health Organization released the Global Report on Ageism. It contains, I think, one of the best comprehensive definitions of ageism. Ageism refers to the stereotypes, how we think, prejudice, how we feel, and discrimination, how we act, directed towards people on the basis of their age. As Commissioner, I've made it my priority during my term to address 3 major manifestations of age discrimination: elder abuse in the community, age discrimination in the workplace, and older women's risk of homelessness. While I hold deep concerns and a commitment about the issues in aged care, it's not been a central focus in my role. This is because there is an Aged Care Quality and Safety Commissioner, etc., responsible for protecting and enhancing the safety, health and well-being of people receiving aged care services. In addition, the federal government also funds the Older Persons Advocacy Network, OPAN, with the responsibilities to advocate for older people in residential aged care and aged care in the home. Having said that, my team and I have kept a very close eye on the Aged Care Royal Commission, especially in relation to the central human rights themes that have emerged concerning the delivery of personal-centred care and issues around autonomy and independence. I'm also a member of the Council of Elders, a very feisty group, I must say, which was established by the Australian Government to consult with senior Australians and provide advice about aged care reform and age generally. I'd like to return to the underpinning issues of ageism, perhaps the least challenged form of discrimination and the least understood. Yet, ageism affects everyone. While my work is primarily focused around the impacts on older people, I've also led research and supported intergenerational projects to enhance the understanding and address misconceptions about Australians of all ages. Nobody's immune. We make judgments about young people as well as older people. Ageism is an obstacle to the experience of ageing positively. It can result in older people feeling they can't exercise their rights and that their concerns are not being acknowledged and addressed. Ageism can be malevolent or it can be benevolent. Families, health professionals and institutions can overprotect and reduce an older person's autonomy, sometimes to the point of malevolent ageism, which can lead to ignoring their wishes or worse. Ageism can be two-way. People can be ageist, making assumptions and judgments about what someone can and cannot do based on their age. To give an example, a 96-year-old friend of mine in residential aged care was assumed to have an age-related hearing loss. I indicated that I'd go to see her, and she said, "You better check on that computer of yours because Kay Patterson's coming." An audiologist appeared the next day. The audiology examination found her hearing, not her hearing aids or her hearing was obstructed by impacted earwax. It was fixed, and gosh what, her hearing aids suddenly worked. It's the assumption that her loss of hearing was age-related and there was nothing much she could do about it. She was then able to listen to the television, make telephone calls. What a change. That was ageism at its worst. We can also have ageist views about ourselves, known as internalised ageism. This can have detrimental effects on our health and well-being. The domino effect is that older people may feel they can't exercise their rights or speak out to report abuse, and that was seen in the Royal Commission. This underpins their acceptance of elder abuse, particularly in its most rife forms of financial and psychological. Elder abuse can start with benevolent ageism, where attitudes tip the scales towards protection and away from respect for an older person's independence and right to make decisions. Some of us need to think about how we deal with our parents. I had to confront that when I thought I could make decisions for my mother. When taken to extreme, these attitudes can result in elder abuse, leading to real harm to older people, be it financial, physical, psychological, sexual, neglect, a combination of these, or sadly, even death. Perpetrators of elder abuse are often family members, mostly adult children, but they can also be friends, neighbours and acquaintances and other people they trust. Worryingly, the current cost of living pressures has the potential to exacerbate the risk of elder abuse. We all need to be vigilant against the likely increase in financial exploitation, particularly for families in the current and looming economic environment. I hear many accounts of abuse when I speak to people across Australia. Only recently at a meeting in Wollongong, I was told about an adult son who became his father's attorney under a power of attorney and refused to pay for much needed residential aged care. The aged care provider placed a caveat on the father's house due to mounting accommodation costs, learning the son was redirecting his father's pension to his accounts and was about to transfer the family home. Despite court action, temporarily removed financial control from the son, this was eventually returned and the son transferred ownership of the house to himself. He never visited his father again, who died in care 4 years later. That is not an uncommon story. I would hear that 6 times a week about somebody often losing their whole home and appearing in a community legal centre homeless. So what are we doing to address these issues? In my role as Age Discrimination Commissioner, I've been arguing relentlessly for the implementation of the recommendations from the 2017 Australian Law Reform Commission report, Elder Abuse, a National Legal Response, launched 6 years ago this month. For this, I've been advocating for all Australian Attorneys General to agree to harmonisation of powers of attorney, enduring powers of attorney laws across jurisdictions, and national online register of enduring powers of attorney. But the call for harmonisation started long before this report of 2017. Back in 2007, the House of Representatives report, older people and the law, considered the best means for promoting powers of attorney and even then recommended the implementation of uniform legislations across jurisdictions. The Australian Guardianship Administration Council in 2019 produced an excellent booklet, You Decide Who Decides. Seems fairly reasonable. You know, make your enduring documents so you can decide who decides, to help people plan for future financial decisions. The booklet is filled with reminders about the different requirements in different jurisdictions. And if you read it, it's check Western Australia, check Queensland, check New South Wales. I had the privilege of launching the booklet and said I hoped it was out of date sooner rather than later, in the wishful hope that harmonisation would be resolved. Not so. Current inconsistencies across jurisdictions cause confusion in the community, making it difficult for families to understand the rules and for those providing advice across our states and territories. They also impede cooperation between state and territory advocates, public advocates, in investigating instances of abuse that involve a number of jurisdictions. Harmonisation would make it easier for families to look after older family members in other jurisdictions and for people to be educated about their rights and attorneys about their responsibilities. For example, when I visited seniors groups, very few people know they can revoke their power of attorney. Pre-COVID, I went with the former CEO of Seniors Rights Service New South Wales, Russell Westcott. Russell's here today, who was, and we had a number of info bingo gigs around country New South Wales. Bingo and lunch brought audiences of 250 or more older people, and we embedded in the program information about planning ahead. Keen bingo players would come early, sit up the front with their little things to stamp, and they're eager and early, and we were castigated for calling slowly, and our card checking wasn't up to scratch. So I don't think bingo is going to be my next career when I finish this job in 4 weeks' time. However, at every meeting over lunch, people came up to me and said, I never knew I could revoke my power of attorney. My son is taking money out of my account. I'm going to change my power of attorney. That is appalling that people aren't aware of that, and they should be, and we need to do something about it. Banks are also concerned. The banks have identified hundreds of thousands of dollars being transferred annually by attorneys from their principals' accounts into their own accounts. Now, while that movement of funds isn't always conclusive of financial abuse, it does raise red flags, and at the very least points to a pressing need to educate attorneys about their responsibilities, including to act in their principals' best interests, not to mix their money with the principals, and to keep good records. Principals also need to know they have a right to change, revoke and set conditions on their enduring documents when they have capacity. There's no doubt there's greater public awareness about elder abuse since it first started to gain recognition in the 1990s. This is the result of efforts from the sector, various governments, individual advocates, and of course, law reform report and responses. I'd like to acknowledge the collective efforts, including strong support for harmonisation of laws led by our Commission work and the Australian Banking Association, Anna Bligh. She often says we're on a joint ticket, and we have been for 6 years. This is also supported by key peer advocacy groups, Elder Abuse Action Australia, Older Persons Advocacy Network, Council on the Ageing, National Seniors Australia, the Combined Pensioners and Superannuants Association, and the Consumers Federation of Australia, among others. That is enormous support for harmonisation. In addition, work has been carried out by the public advocate in Queensland, Dr. John Chesterman. I'd like to just say how supportive he's been of me in this role. He's provided a draft model for financial enduring powers of attorney, supported by a number of legal and advocacy services. So the document's there. The Commission, the Australian Banking Association and other advocates have often written to the Attorneys General before their regular meetings. I think they expect the letters now. The replies we get about these legal reform issues are, in essence, it's on the agenda. Not reassuring when the House of Representatives' 2007 report said that the issues were first brought to the attention of the Attorney Generals back in the year 2000, 23 years ago. In fact, that it's still on the agenda is cold comfort. Despite the glacial progress on enduring power of attorney reform, there is no doubt Australia has made progress. We now have a national plan to respond to the abuse of older Australians, just about to expire, and a new one being worked on. A national elder abuse peak in Elder Abuse Action Australia, compass.info, a one-stop online elder abuse hub, and the continuation and expansion of elder abuse service trials, including specialist elder abuse units, health justice partnerships, case management and mediation services. We also now have a national elder abuse phone line with calls being directed to service providers in each state and territory. I strongly advocated for this number, 1800 353 374, which almost didn't happen. And my team and I have been raising awareness of it through various campaigns and activities. Calls to this helpline have been increasing steadily since its inception in 2019. This year's statistics so far indicate a rise of 28% compared with last year, meaning the call line is likely to record its greatest year of demand in 2023. This increase is also being experienced by specialist services in various states, with some recording as much as 40% rise in the first quarter of this year. It's arguable whether this is due to the rise in awareness about elder abuse and/or a rise in incidences. But irrespective, we must plan and take action to prevent the risks and occurrences. My team and I have continued to develop elder abuse awareness materials, including bookmarks, posters and social media tiles in 20 languages to raise awareness of the national phone line. Since 2019, we've distributed almost 500,000 elder abuse bookmarks to 49 partners across Australia. The Commission has also launched 3 elder abuse video campaigns on radio, television and social media, and getting amazing coverage to increase community awareness of the red flags of elder abuse and where to get support. What really needs to be done to protect the rights of older people to reduce ageism? The 2021 National Elder Abuse Prevalence Study found that the family, friends, GPs and nurses are common sources of support for older people who experience abuse. This is why it's essential for anyone who meets with older people to know the signs, or works with older people to know the signs and be equipped to respond. What I want to impress on you is the plea of pursuing a culture that supports older people in all aspects of their life and all living situations. Everyone has a responsibility to be vigilant. We need as many eyes and ears as possible in the community to combat elder abuse. There are 5 simple steps we need to know. Understanding the flags, red flags of risks of elder abuse, helping other people understand their rights, encouraging people to prepare planning ahead documents. Documents such as wills and powers of attorney are important tools for safeguarding a person's preferences as they age, not just when they're old. But I caution they can also become instruments of abuse. It is critical that older people understand their rights and someone's appointed decision maker understands their responsibilities. We have built on this work at the Commission with the 2023 project, Have You Thought About Later Life? This is an education campaign in 6 languages which urges older Australians from a range of culturally diverse backgrounds to safeguard themselves against elder abuse by organising their important documents, and you can find the resource on our website. We need to help older people to stay connected. Isolation is one of the major risk factors in abuse, and we need to support them to know where they can get help. Time restricts me, but you can find more information about elder abuse on the website www.compass.info. In addition, be aware of internalised ageism. Professor Becca Levy of the Yale University identified a significant association between internalised ageism and deteriorating health outcomes. She asked her health and ageing class students to picture an older person and share the first 5 words that came into their mind. The responses included admiring words such as wisdom, creativity and roles such as grandmother. But senility came up a lot, stooped over, sick and decrepit. Despite this, Dr. Levy has found reason for optimism. By exposing people to words like active and full of life instead of grumpy or helpless, she's helped older adults in the way they describe themselves and obviously helped their students. I challenge everyone to undertake such a mission, to pursue a culture to reframe the way we all consider ageing about others and also about ourselves. Older workers. Australians are increasingly working to older ages. The average retirement age is rising and pensions eligibility is rising. Despite this, older adults face cumulative barriers to gaining employment, such as age discrimination, illness or injury, loss of confidence. Susan Ryan found that when women were turned down for a job, they were less likely to try again, for example. Lack of training opportunities and increased caring responsibilities. Digitisation of many processes, including the recruitment process, may disadvantage certain applicants, such as older adults and those in low-income work. This can also feed internalised ageism. A key function of the Australian Human Rights Commission is to investigate and attempt to conciliate complaints of discrimination or breaches of human rights, including age discrimination. This is work not done by the Commissioners, but by the Commission's Investigation and Conciliation Service. In 2021, the Commission received 271 complaints about age discrimination, about 6% of all the complaints received. The majority of these complaints were about employment and came from complainants over 55. When it comes to the workplace, age discrimination can occur at the point of recruitment, in relation to opportunities for training, development and promotion, access to flexible work practices and strategies around how retirement is approached. Ageism in the workplace has helped drive our focus area around older workers. This year, we again partnered with the Australian Human Resources Institute for the 5th time on employing and retaining older workers, an important report which provides insights into the employment climate for older workers and the shift in perception around our ageing workforce. This builds on the data collated in 2012, 2014, 2018 and 2021. The report also reflects employment data and the increased workforce participation in older Australians. Despite the 2023 labour market being tight and flexible work practices more acceptable, ageist perceptions and employment practices prevail. In the 2023 report, we found that 18% of employers still have an age above which they definitely or probably won't recruit. The good news is that this percentage has been dropping over the years. Susan Ryan's first report, it was 52%. In 2018, it was 30%. In 2021, it was 27%. While this is an improvement, we still have 18% of employers who say they won't employ someone or they prefer not to. It's not good enough. Age discrimination persists despite this contradicting the real-life experience of working with older people, as noted in this survey. Many employers reported no difference between older and younger workers in terms of job performance, concentration, ability to adapt to change, energy levels and creativity. Advantages of older workers were found to be coping with stress, attendance, reliability, awareness, commitment and loyalty. Advantages of younger workers were their physical capability, ambition and proficiency in using technology. It seems to me that most workplaces would need a combination of all these skills, and I encourage employers to look at it. Did you just ding me?
No.
Oh, I thought I heard a bell. I was hoping there was a bell there. Older women at risk of homelessness. But what happens to older people when they can't work, particularly the current cohort of older women who didn't have access to compulsory superannuation when they started working or have been in and out of the workforce? Older women are the fastest growing group of people who are homeless or at risk of homelessness. The latest numbers that we have are from the 2016 census. I presume that will be updated with the information from the latest one. But risk of homelessness increased 31% between 2011 and 2016. Their circumstances may vary. The end of a job, illness, or, for example, can force them into this dire situation. Stable, affordable housing is a key safety issue for older women. Given my resources, I've focused on one group. Those at risk of homelessness, they're really hidden. They're working, single, living alone. They have some hidden assets or capacity to continue working. They've lived conventional lives and find themselves at risk of homelessness as they approach or enter retirement. In 2019, my team and I launched a paper, Older Women's Risk of Homelessness Background Paper, and explores the risk factors for older women. For some women, a single crisis or circumstance can result in homelessness with little or no warning. What can be done? During my discussions with a range of people who are working on this issue across various sectors, I've heard about some very innovative models. We need multiple solutions which consider the range of circumstances of the women in question, from their assets, income and capacity to work, their age, through to their housing requirements and preferences. No one woman is the same as another in terms of their needs and those issues. The aim must be to enhance women's housing and economic security across the remainder of their working lives and through retirement. I've discussed preventative solutions with a range of stakeholders. There have been some heartening developments, such as creative community housing groups providing shared equity housing, and some developers have provided some affordable housing within a development. I've worked closely with the Retirement Living Council and the Property Council, have been pleased to see their responses to utilising vacant units. Some of them had a lot of vacant units, some 21 and 30 in one facility alone. I did challenge them at my last meeting at their national event and said, if you have one vacant unit when somebody's sleeping in a car, it's a disgrace. Measures like this will make a big impact on those older women who have some assets, but not enough to buy a home or retire without dread of how long their savings will last. I've seen this model in action, and older women are delighted to finally have the security of a home. Developing practical solutions require engagement across sectors through all levels of government: property, finance, business, including banks and superannuation funds, self-managed superannuation funds, property developers, planners, the retirement living sector, through to the not-for-profit sector, including community housing and philanthropic organisations. There is a lack of incentives which could be cost-effective and be considered to encourage members of super funds or SMS funds to invest in approved shared equity funds, or for investors to do the same. We need coordination and collaboration to look at what works and what the barriers are, and they are significant. We need local governments that go beyond talking the talk to supporting innovative building applications, to consider changes to planning laws, and to consult women on housing design. A bedsit or a one-bedroom apartment is preferable to couch surfing or sleeping in a car. We need an online hub to collate and share the range of innovative models explored and initiated across Australia and internationally. Given we're in the press club, I'd like to touch on how ageing and older people are reported in the media. I'd ask the members of the press to reflect on their own thoughts about older people, their own personal experiences of ageing, and consider how they might challenge perceptions of ageing and how the reporting of ageism and elder abuse is undertaken, and how your reporting may be ageist. According to a Queensland University of Technology study published last year, ageing, and particularly aged care, is too often represented in a negative light. Older people are being dehumanised and homogenised in how they are portrayed in the media. And I quote from that report, "It isn't fair." A 91-year-old man paragliding had an accident. They, the media, were interviewing him in his hospital bed, and he said, "I can't wait to get out there to go on another flight." When I first saw that, this is a person in this research talking when they were being interviewed. When I first saw it, I thought, what an idiot, he should know better. But then I thought, he should do what he wants with his life. I shouldn't judge him and say he should be in a nursing home watching TV. We all can be ageist towards ourselves, towards others, and in jobs, even unconsciously. Let's aspire to be fairer, more accurate, so ageing is something we embrace rather than fear. We all have this responsibility. At the Commission, we understand from the World Health Organisation's 21 Global Report on Ageism that education and intergenerational work are real antidotes in addressing ageism. We followed up with our report, What's Age Got to Do with It?, and with a new project called Changing Perspectives at Testing and Ageism Intervention. This work evaluates the effectiveness of educational intervention in reshaping beliefs and perceptions about ageing and older people. Among those providing services to older people in aged care, so we looked at 300 people who are working face-to-face with older people. To date, the team has completed ageism training with more than 300 aged care, and I'm just smiling at one of my staff who's been doing this work, but 300 aged care and community workers in urban and rural settings. The final report is due to be released soon, in fact 2 weeks' time, and the findings are groundbreaking and newsworthy. This work supports my long-held belief that ageism may be the most common and accepted form of prejudice, but it may be also the easiest to shift, as is evident from the participants' post-workshop, and I quote, One of the participants said, "I want to check myself for prejudices when meeting new people. I want to be aware of my language, attitudes and some subconscious limitations I may put on people due to their age." The results are outstanding. I wish I could share them with you, but the report's not quite finished. I encourage you to share stories about ageing, this is the press I'm saying, that help address the dominant perception that this life stage is a time of dread, decline and decay. There's much to look forward to in growing older, particularly if we can avoid internalised ageism and able to maintain our health as long as possible. Intergenerational wisdom and shifting ageist beliefs was also one of the main takeaways, another project we supported. In May this year, I had the privilege of being MC at the opening of the Centenarian Portrait Project by Teenagers, a national exhibition at the Belconnen Arts Centre. I've been involved with this project since its inception 7 years ago with creator and collaborator extraordinaire Rose Connors Dance, who's sitting there with us as here today, and with one of the teenage artists, Rika. I was fortunate to meet many of the 465 centenarians and 465 teenage artists from across Australia who created their portraits, and I was involved at the opening of every state exhibition, one virtually because the plane was cancelled. I've been inspired by the magical relationships, the growing understanding between generations and the incredibly strong bonds that have developed between the centenarians, the families and the artists. The project counteracts ageing stereotypes. It highlights the rich tapestry of life in Australia, not only through the amazing artworks, but the stories uncovered by connecting younger and older people. One teenage artist said, "My biggest takeaway from this is ageing is an opportunity for new experiences. It is a fact of life. It's a fact of life that should be embraced and not ignored." The exhibition is still on and closes this Sunday on the 2nd of July. So I recommend you, if you haven't been there, to go out to the Belconnen Arts Centre. Human rights don't diminish with age. We must put older people at the heart of the ways in which we interact with them. We can pursue a culture which supports older people, particularly when it comes to their care. The impending wealth transfer and our ageing population create opportunities for our country to lead the way in creating inclusive communities which celebrate diversity, including people of all ages. We must plan and invest in the outcomes we seek as a nation. We must build a better cultural inheritance for an ageing Australia. I've focused on ageism, as the WHO has found. Ageism is highly prevalent. However, unlike other forms of discrimination, including sexism and racism, it is socially acceptable and usually unchallenged because of its largely implicit and subconscious nature. Let's challenge that. Ageism may be the least understood form of discrimination, it is pernicious and it's pervasive. But as our research has found, it can be shifted. I'd like to see more collaboration from governments, philanthropy, the private sector and the media to address this challenge. Ageism is the underlying cause to most of the age discrimination areas we work on at the Commission. The results have devastating impact on our community, including older people who want to continue work and older women who would like the security of a home. These are issues which can and should be resolved. Elder abuse is a wicked problem. It has serious and often devastating effects on health, well-being, dignity and autonomy of older Australians. However, and wherever it manifests, and regardless of the reason, elder abuse has no place in our community. One of the biggest policy changes that would have the most impact on elder abuse would be nationally consistent enduring powers of attorney across jurisdictions and a national enduring power of attorney register. Individually, we also have responsibilities to ensure that we are aware of the rights of older people, have documentation in place to protect our rights, and if you haven't, go and put a notice on your fridge and get your enduring documents done. Know the support services available, be mindful of internalised ageism, be mindful of the perceptions about growing older, either your own, in your work, or that of people in your network. Lastly, remain connected to others, including friends, family and community groups. My term as Commissioner concludes at the end of July, but I will keep a watching brief and keen interest in the advocacy issues for older people experiencing age discrimination. This includes the progress of enduring powers of attorney harmonisation on the agenda now, and I repeat, for 23 years. The future work of the Australian Human Rights Commission and the progress we all make in addressing ageist perceptions to combat experiences and risks of elder abuse. Together, we can build a different cultural inheritance for an ageing Australia. And in fact, we must. As I say at the end of almost every speech that I make, the culture we accept now will be the culture we inherit as we age. Thank you.
Thank you very much, Dr. Patterson, for your speech there. I think it's something we can all relate to because we're all getting older. Look, I just going back to your bingo anecdote during your speech, and what struck me is that it seems like for a lot of older people, they actually only start to think about these issues when they get old, whatever old may be, you know. And it's often dominated by things around, you know, financial security and things like that, and it doesn't maybe look at those, you know, questions that go to what your rights are and things. What sort of, I guess, education does there need to be, perhaps, for people to get in the idea of thinking about these issues before they get to being old, and perhaps having to make these decisions and find out about this in a rush, you know, because of their circumstances?
Well, thank you very much, Andrew. I've found a great friend in Brian Hurd, a lawyer in Queensland, who has been agitating about these issues for a long time. And when the Law Reform Commission report was launched, he was on the radio saying, well, nothing will change. So I decided I better disabuse him of that and rang him. We've become firm friends since. And he's a great advocate and has all his clients, his expertise in elder law. And he does contribute. He's written a book called How to Avoid the Ageing Parent Trap. And I think it's worth reading. There are lots of things in there that I learned reading it. And he actually gave his 18-year-old daughter a present wrapped with a bow on it, and it was a token or a letter saying that there was money for her to go to another law firm to have her enduring documents done because she should have them the moment she turned 18. You can have an accident, you can fall. And if you haven't got a spouse and there's nobody directly there or for other reasons, the public trustee suddenly has you and they decide, not you. And so I would say to everyone, whatever their age, you should have your enduring documents in place. It's absolutely vital. Anything can happen. You can have a stroke at 25, an accident at 30, and people sometimes leave it too late to make their decisions. And so it's not just older people, it's all of us should take responsibility for ourselves and have our enduring documents in place. But it's very difficult to educate people about what they're allowed to do and what they're not allowed to do because the states all differ. And so if we had harmonised powers of attorney, you could educate people. We just did a toe-in-the-water piece of research with 5, I think 6, I can't remember, Jackie, 6 I think it was, 5, called groups, non-English speaking, as not having English as their first language. They knew about wills, they knew almost nothing about enduring documents. That's appalling. That is appalling, because their rights will be taken away from them if they haven't got their documents in place, probably taken away. So it's absolutely vital for educating the core community, for educating people with responsibility, their attorneys, for the rights. I was never told as an attorney what my responsibilities were. We need to have education, but we need harmonisation. I'm going to harp on it for my last breath because it's so important. And I would call on the Attorneys General to do something about it. Don't just put it in the next national plan or say it's on the agenda. 23 years is long enough.
And just before I turn over to the questions from my colleagues, but you talked obviously about the insidious nature of ageism. How much of it is down to, I guess, what you'd call maybe a culture of intergenerational resentment? We often hear about how the baby boomers had it so good in terms of things like they could afford to buy a house. It's a debate we see today. Probably more secure employment, free university education, those sorts of things. I mean, is there a sense of that you pick up that younger people are sort of like, you know, well, time for the boomers to get a bit back, sort of like a, you know, give them a bit of a kick sort of thing because they've had it so good?
That's an interesting view, because in our What's Age Got to Do With It report, one of the really interesting findings was there was a sense of understanding between the generations that sort of World War III didn't come out, that they said, well, it was different for them, and that group had this issue, and this group had that issue, and also the older people said, well, it's different, but you've had more opportunities for education, for example, and there was this deep understanding, and I think that was one of the outcomes of that research that was heartening to me, that the intergenerational relationships aren't as dire as people say, and you know, I think people get that at different periods in time there are different benefits. I mean, you know, I was born in a time when you didn't have antibiotics. You know, there are just differences for generations, and I think that piece of research, and I'd love to see some more in that area, I think broke that down, that sort of thought that there's a war going on. And I think the press doesn't help that, and I think there's a real responsibility for the press to actually look for where there's stories of good stories between younger and older people, because I think that piece of research got some coverage, but not a lot.
Okay, thank you. Our first question from the floor, Natasha Chrysanthos.
Thanks, Kate. I'm from the Sydney Morning Herald and The Age. I had two questions. First, continuing on the theme of elder abuse, I was wondering what you thought around the kind of increasing legislation, or legalisation rather, of voluntary assisted dying, and whether, particularly considering dementia projections, this presents any concerns or risks, and whether you think there are adequate protections there given the dynamics that you talked about.
That's an issue that's been raised as VAD has increased across mostly all jurisdictions in Australia. And only the other day with the Council of Elders, we were, I think, having a discussion, a general discussion, not in the meeting, but in morning tea and afternoon tea. And people said, well, shouldn't I have the right to make a decision about what happens to me if I become and lose my capacity totally, and I'm unresponsive? Shouldn't I have the right to have voluntary assisted dying and have that in my enduring documents? And I think that's a discussion that will start being had. One of the things I think we've got to remember is that every single human being is important. They've had an experience in a life, and we have to be very, very careful about any legislation we introduce. But I do think it's appropriate to have a sensible debate and discussion about that issue, because you've got to have your capacity to make the decision, and maybe you should be able to put it in your enduring documents, but I think it's a discussion that should be had.
And also on aged care, I know you said it's not your area, but as a former health minister and someone who does watch the space, going back to Minister Wells' speech here a couple of weeks ago, what are your thoughts on the funding issues facing the sector? And do you think something like a levy or increased consumer contributions will be necessary considering the population projections you spoke about earlier?
Look, I don't want to stray onto the policy of funding of aged care. There's a long history. I could give you a history lesson on how hard it was to get a contribution into aged care when there was an introduction of a contribution into hostels. When it was shifted across to aged care, when they were separate facilities, that was resisted. It's a fraught area, and one of the things I think you have to think about is you might care for your parents at home, you might not receive any aged care in the home, and you're working and paying taxes. And the question is, should you have a levy to pay for people in a nursing home, 40% of whom do never get a visitor? And I think we've got to look at very, very broadly at how we need to fund aged care. It's not going to be sustained. But the other thing in aged care I'm concerned about, I don't want another Royal Commission in 15 years' time, and I'm sitting in an aged care facility looking at the Royal Commission on abuse of aged care in the home. We haven't got the same oversight as you have in an aged care facility. That is a real issue that has to be addressed. How do we make sure people are protected? As more and more people get aged care in the home, and what aged care in the home, they need to be protected. That's another issue, not the answer to your question. But the aged care question, I commend Arnica Wells for putting together a really very forceful workforce group to reply to her very quickly on this difficult problem of funding of aged care. But it must be fair to everyone who is in aged care and who doesn't use aged care and provides for their parent at home.
Mm. Do you have a view on the fairest way to fund that?
Yes, but I'm not going to...
Please.
Come on, you're among friends.
And I've got very good friends on the workforce, and I've already had a chat to them.
Sure. Our next question, Tess Economy.
Thank you very much, Commissioner. I'm from AAP. What was your reaction to the tasering death of Claire Nowland, and what must change in our approach to aged care residents with dementia?
I don't want to talk about that particular event. I wasn't there. I know that some of the press reporting has not had all the facts. There's also a police officer who's being charged. So I think it's to look at the overall thought. It is not always easy. And, you know, I've visited a lot of nursing homes as a senator. And people with profound behavioural problems, with dementia, are very difficult and challenging. But they have rights too. I think we need, and I did say in estimates when I was asked this question, is a police response the appropriate response? Because that's what the Royal Commission argued for. But maybe a different approach might be the sort of approach we have for mental health in the community, you know, a SWAT team who comes out. That's difficult because there's an aged care, numbers of aged care facilities spread to the whole of Australia. How do you get that? Some states have done a lot more training of police on how to deal with those issues. We expect them to deal with car accidents, to deal with chasing criminals, and to dealing with people with dementia in an aged care facility. It's a real challenge. And I think my response to that is this has highlighted a real need to re-look at that and make sure that the people delivering the service and the people who've got dementia are both protected in a way that doesn't end up with what happened the other day.
Thank you. Next question is Nick Stewart.
G'day. I know my father, Ron Stewart, will be watching today, so could I just get you to reiterate where the power lies in these relationships between older people and younger ones and enduring power of attorneys? So, in particular, they can be cancelled at any time?
Depends on which state you live in.
Who are the reclusive states that are holding out? Which state? No,
it's not. That's not the issue. Yeah. The issue is if you had a harmonised power of attorney, the rule about revoking. Some, when you rewrite your power of attorney, it's revoked automatically. Others you have to revoke. Now that's, you know, it should be able to just say to people, you can revoke your power of attorney by redoing it, or you can revoke your power of attorney. One rule. Look, we only 25 and 26 million people. We can't actually organise powers of attorney. It just blows my mind. You know. And then you can't educate people about that role. You can't educate. People think, oh, it's okay if I just take a bit of money out of mum's account because I do more for my brothers in Queensland. Well, no, that's not how it works. You know, you don't mix your money with the principal's money. And the banks have got a concern as well. Somebody comes in and says, I have my mother's power of attorney. They don't know whether it's up to date or not. And that's one of the things they say to us. If only we had a register, we could say, sorry, you don't have your mother's power of attorney. They're in a dire situations. And I have to say, some of the bank officers go beyond their remit. You know, they're working in a country town. They know that this is happening. They know the son. They come in and out, taking money out. They don't think he's got an up-to-date power of attorney. They'll sometimes ring the customer, the principal. Yeah, but they're in a very difficult position. And somebody comes in and says, I'm here with my mother, I want to take $50,000. She wants to take $50,000 out. The bank will say, would you like to speak to the manager on your own? Yes, but if I don't see, I won't get that, I won't see the grandchildren if I don't give him the money. What does a bank do then? I mean, it's really challenging, but having a register would actually reduce some of those people, not misusing a power of attorney, misusing a power of attorney that doesn't exist or is it out of date?
Because we are only a country of 26 million people, should this be a national issue that the federal government takes responsibility for?
I've been trying to make it a national issue for 7 years, and the House of Reps had it, and 23 years ago it was on the attorneys. If you can do something about it, if the press can press for it, it should be done. It is difficult, but it's possible, and it's one of the major things that can be done to avoid reduce the likelihood of elder abuse, especially with this $2.5 trillion transfer of wealth.
So a task for Annika Wells?
No, attorneys general.
Oh.
Thank you. Back to Tess from AAP for
Thank you very much. Should eligibility for the National Disability Insurance Scheme be expanded to people aged 65 and over? If not, why not?
Well, there are exemptions in the Act, and if a government says that this is the, you can't be a policeman in Queensland over 60, it's exempted because it's a law made in Queensland. The rule here is that, and it's a long story because there's a historical transfer of responsibilities in the beginning of the NDIS, which I think I could do a whole talk on that, but I won't. It is difficult, and it's an issue that there's a class action at the moment about it. Ben Gauntlet and I have written to the Attorney General, talking about Attorney General Health Minister about that. There's a limit to what we can do in discrimination because it's a legislated age rate gap. It's absolutely vital. I've got friends here in Canberra who are both in wheelchairs, and they, and one of them with post-polio, can't get the sort of service they might have got if they'd had this had a disability before 65. It seems odd to me that one day before you turn 65 and you develop a disability, you get the NDIS, and 2 days afterwards you wouldn't. And I think the class action and the pressure that's on now means that we should be looking at, and it's often about AIDS, about wheelchairs and all sorts of things. I think it needs resolving. Thank you.
Our next question is from Randall Markey, probably his first one since he was Bureau Chief at the West Australian.
I think that's right. Long time member of the National Press Club, and I should, in the interest of full and frank disclosure, say that I did work for Dr. Patterson. I had the privilege of working for Dr. Patterson some 20-odd years ago. Thank you for your speech. Look, we've heard about elder abuse and age discrimination and perceptions that it's not fair. There is some perceptions, as you've talked about age being indulged and indulgent and privileged. I just wanted to ask, and you have been asked the question about aged care and sensibly probably steered clear of that, about the funding. I wanted to ask about some local latest developments about the so-called Bank of Mum and Dad and also HEX fees. I increasingly hear of some people who are able to have pressures from children and others to pay these things. I'm just wondering if you've come across this, or you're aware of this. Is it an issue of increased pressure, and does it sort of affect the retirement status of people trying to juggle all these things?
It hasn't been raised with me officially. I've read about it. It's not just about HEX fees. It's about, during COVID, people, a son or a daughter moving back in, oh, Mum, this house is too big for you, you need to sell it so I can buy something because our marriage has fallen apart. There's pressure after pressure after pressure to actually get inheritance early. I think there are a number of factors. One is that that generation has accumulated, not all of them, but some have accumulated wealth. The other thing is that I've lived 11 years longer than my grandmother, nearly 10 years longer than my mother. People are living longer than they expected. Their parents have lived longer than they expected, and maybe thought, oh, well, Mum and Dad will be dead, I'll get half the house, my sister will get half the house, and we can manage this mortgage. Well, we shouldn't plan for that. We know that longevity is increasing, and people are fit and well and say, well, this is my home, and I want to live in it the way I want to live in it, and it's none of your business. So I think it's not just the HEX debt, but I think it's all sets of other debts that put pressure on families. And there's lots of psychological abuse. If you don't do this, you won't see the ground. If you don't do this, well, we won't come and visit you. And that's incredibly powerful. Grandparents' relationship with their grandchildren is an incredibly strong bond, and to be threatened that you won't see them, well, what am I going to do? I'm most probably going to cave in. And I think we all need to be responsible for seeing red flags like that, but also in looking at our own behaviour, because sometimes we can be ageist in ourselves.
Thank you.
At the Human Rights Commission, you're at the pointy end of discrimination debates in this country and things like that. Also being a former minister, you've got a good understanding of policy. We've currently got a debate, obviously, around the voice to Parliament on that. I just wonder if you've got any thoughts on that, as someone who's sort of, been a policy maker, but also too can see the impact of discrimination, what it might mean.
My wish is that this debate had been, or the structure had been discussed earlier rather than later. Referendum are very hard to get up, we know. And if there's not bipartisan or or quarter-partisan, whatever it is now, support, it makes it much more difficult. So I think I would have rather seen a structured debate and maybe a more normal approach to a referendum. So we had the sort of national debate beforehand, which didn't happen. But having said that, my view is that the highest human rights order is that we have a dignified, respectful and debate where people aren't called names, where people aren't called racist, where people say we all have a right to our view and we should respect that. And that's, I think, the highest human right order, that we have a right to have a view, we have a right to have a say without being lambasted or criticised from one side or the other. But I would have liked to have seen a bit more thought beforehand to try and get a more bipartisan approach.
Do you think a voice, going back to your days as a minister, do you think a voice to Parliament, executive government, would have been useful for you? Would it have been when you were making decisions around health outcomes for Indigenous Australians?
One of my saddest, a sad thing, often you have things that you've done or haven't done in a job. One thing was tried to have a minister and a department responsible for an area. So instead of the Indigenous community, say in Wadeye, where I had one was in the Pitlands, another one was Wadeye and the northwest coast of Darwin, where instead of going to every department, that department was the key department with one department in the Northern Territory. And I went out to Wadeye for about 5 days. I took my staff, one of them's here. I made them drive from Catherine so they got how far it was. And we had a car breakdown and we had to go through rivers and heavens knows what else. But I wanted them to get a feeling for how far it was away. We got there and the women took us out into a very remote beach, and we had a most wonderful time with these older women who, and they said to us, one of the things they wanted was the school year to be changed. To be during the wet, when there wasn't as much grog in the community, and they could take the young people out to the homelands and educate them, in catching and wallabies and doing all the sorts of things that they did in their childhood, and learning some skills in their culture. The teachers all agreed, everyone agreed. I would go back to the minister in Northern Territory. Oh, that can't be done. And I was hundreds of kilometres away from any other place. We'll do it for 2 years and just see how it works. This is what the community want. If we have a voice and they don't listen to the community, it'll be just as bad as that. And so the important thing is that, and the people who need to be heard are the people in remote and rural communities. It is a disgrace, some of the things I've seen in remote communities. People who haven't been out to them would be horrified at the price of cabbages, at the fact that the dogs and animals aren't treated and have ulcerated uterus hanging out and kids touching the dog. It's terrible. And we should hang our heads in shame. Whatever we do, it's got to work, because it is far too long that particularly people in very remote communities have been treated the way they've been treated. I am ashamed, as should everybody else who's been involved in policy, that somehow we haven't got it right. I hope this is right, because otherwise it's going to be in the Constitution forever. But I do hope that people in very remote communities get to have their say, because it's no good flying in and flying out. We've got to have people who are there on the ground and making sure. I mean, I just looked at some of the places and looked at the shops, and there just wasn't proper food there. I went to one place where there was an Indigenous leader who was tough, and she had an Indigenous person running the shop, and they had food that they'd cooked, they had people classes. That community was zinging along. And so when you get a community that has that leadership and has the support, you get changes. But I just I just hope and pray whatever we do, we get outcomes and results, because it's those people that we should feel very, very responsible for.
Thank you. Our next question, Maurice Riley.
Thank you, Commissioner. I'm asking this question for Tim Shaw. What advice do you have for the new Commissioner?
Well, I don't know who the new Commissioner will be, because it closes, anybody who hasn't applied, it closes on Friday. And I hope I'll be like Susan Ryan.
Okay.
Susan was there for me when I couldn't go to something. If she could get an airfare or get transport to the place, she went for me. I just think that I'd like to be helpful. I want to see what things they want to focus on, and then if there are things that I can do outside of that. But I don't think it's the role for an ex-commissioner to take on an area that the new commissioner is involved in. But I do have some. I've been making notes. Harmonisation of power of attorney is the first one on the list.
And our final question for the day is for Rika. Unfortunately, I don't know her surname.
Jammer.
Intergenerational relationships as a way to combat ageism. What do you think are some key initiatives that can facilitate these kind of relationships, and how do you see these programs benefiting the community?
Hi, my name's Rika. I'm an artist involved in the Centenarian Portrait Project for teenagers. Sorry. So, sorry, I'm not very
That's
organised.
okay, Rika. Let me just say to people while Rika's looking for that, I have met some absolutely wonderful young people who've been doing the portraits, and the portraits, some of them, are just amazing. I think somebody in 30 years' time will have a very valuable portrait when one of the young people now is a triple winner of the Archibalds. And so one of the gentlemen said when he got a sketch, one of the precursor sketches one of the boys did, he held it up and he said, "I'm going to hang on to this, it could be worth a fortune." Rika, you ready?
Yeah. So I guess I got to know the late Laurie Horace Hancock as part of, well, he was my centenarian I was partnered with in the project. I guess by getting to know someone of this different generation, I learned, I guess, the importance of genuine connections, genuine care and interest, even from someone, kind of a world away. It's kind of how I would describe it. I'm 18 and he's 100. I thought we had nothing in common. We actually did have a lot in common, but no. So as I was discussing with Rose earlier, intergenerational projects, they create ripples in the community. That we need these projects to create awareness and understanding of the issue of ageism. And it faces both young and old people. I've experienced it myself sometimes. And I would describe this relationship with Laurie, and I think all the other artists involved in the program would say the same thing. It's something valuable that I think people don't think about in terms of relationships they have with older people in their lives. And I think these connections need to be more valued, not just as volunteers, but also as skilled workers, skilled and educated workers, of people who can give older people who are overlooked sometimes a voice, I guess.
Thank you, Rika. Thank you. And if you go to the exhibition, you'll see Rika's painting of her centenarian done in green oil pencil. It is beautiful, but he's going like this. And what's he doing? He's counting and telling Rika the names of all his 27 grandchildren. And it's just the most beautiful portrait. I'd steal it if I could. It is just beautiful. And Rika is one of the Canberra artists. We had Canberra artists here all of whom their paintings appeared on the exhibition. If you haven't been, Max, could I say something? Max Burke's here, my sister-in-law's uncle, and who's a neighbour, dragged in everyone I knew. Max was head of Arts Council of Australia. He wrote me a text message and said, I've been to hundreds and hundreds of art exhibitions. This is the most uplifting of the arts exhibitions I've been to. What, Rose? How wonderful is that? You should meet Max. He's not easily pleased. And for him to say that, I jumped with joy and sent Rose the email. So thank you, Max, and thank you, Rose, for all you've done. 465. That's 4 times the number of people that were centenarians when I was finishing my PhD, that she has met with. You go to those paintings, you'll say, that's Jack, and his artist was Melinda, and they did da-da-da-da. The whole 465 she knows by name. And she's just received a grant from DSS to do a music program in Victoria. So all the antidotes for ageism are education and intergenerational activities. This one's doable. You could do it in your local community. You could have school kids going into aged care and doing some activity with older people in a meaningful long-term way. This just didn't go in and walk out. They did lots of visits. They did some training beforehand with Rose. It was a whole project. So congratulations, Rose, and congratulations, Rika.
Thank you. And on that uplifting note, thank you very much for your time today, Kay Patterson. Please accept our gift of membership to the club, and please, everyone, thank you, Kay, for appearing. There you go.
Thanks very much. Thank you.